Hi, I'm Joe Pantoliano, and I'm proud to introduce this new film from the American Foundation for Suicide Prevention. It's aimed at reducing the symptoms and raising awareness and understanding of how bipolar disease works. Over the next hour, you'll meet three incredible people who struggled unknowingly with this brain disease. They'll share their personal stories from their first symptoms, what it was like, and through treatment, how it is today. Living healthier and more productive lives. You'll also hear from a woman who lost her husband to suicide. The goal here is to reduce the stigma, shame, and discrimination associated with this disease so that millions of Americans living with these symptoms will seek treatment and become even greater members of society. And remember, if you identify with these feelings, you're not alone. And there is no shame in asking for help.
The goal for today's film is to learn about the diagnosis and treatment of a particular mood disorder, bipolar disorder. The overall objective is to help you learn about the diagnosis and the treatment for bipolar disorder and how well people can do when they get the treatment that they need. In psychiatry, there are general categories of illness, and one very important category today we'll be talking about is mood disorders. Now, mood disorders basically have two general categories. There's one category in which people have just episodes of depression that come and go. And then there's another category that not only has episodes of depression, but these episodes alternate with highs or mood swings. And that's completely different. It requires a different treatment, and that's called bipolar disorder. The main thing to keep in mind when it comes to how bipolar disorder presents is that it presents during childhood and adolescence and young adulthood. In fact, 50% of people have the onset of this illness by the age of 14, and 75% by the age of 24. When bipolar disorder most commonly presents with periods of depression. So in the beginning, somebody may not even have the highs. They just have episodes of depression. The reason why that's a problem is that up front, until you start having the mood swings, nobody knows that this is really bipolar disorder. And that's really important because the treatment is very different. The treatment for people who have major depressive disorder is a traditional antidepressant. When it comes to bipolar disorder, we know that the foundation for treatment isn't an antidepressant, it's a mood stabilizer. So it's important to get this right. One of the very unique things about bipolar disorder is that more often than not, it is misdiagnosed and treated as if it's just major depressive disorder. The treatment for major depressive disorder is different than the treatment for bipolar disorder. The diagnosis of a major depressive episode, be it bipolar disorder or unipolar major depressive disorder, is basically the same. The symptoms of major depression are the same. During major depressions, people can feel sad, or they can have less interest in doing things that you normally enjoy doing. People can either eat less or eat more. Sometimes people sleep more, sometimes people sleep less. There can be a change and a decrease in sexual energy. But most importantly, people think differently. They feel sad and they feel hopeless. The diagnosis of bipolar disorder can be challenging. The key difference is that in bipolar disorder, people have the depressions and then they go to having mood swings. So you can't make the diagnosis based on the particular type of depression. The diagnosis is made based on the presence of mood swings. Mood swings are just a lay expression for a period of being manic. Manic is a severe mood swing, and a mild mood swing is called hypomania. So the manic episodes, they include periods of increased physical energy, increased sexual energy, racing thoughts, speech that goes fast and sounds pressured, and most importantly, impulsiveness, doing things quickly without thinking about the consequences. In contrast to mania, hypomania is basically very similar symptoms, but they're all very mild. So mild that they don't even need to result in impairment. They just need to result in some significant change in behavior. So hypomania is a mild mania. Mania can be a lot of fun. You know, you feel like $1 million, top of the world, feel like you can do anything. However, there's another type of mania in which you feel irritable, agitated, restless, and depressed. Sometimes it looks and behaves like depression, but it's really mania. Why? Because there's lots of energy.
In 1973 is when I had my son. And that's when the signs really started. I was very angry, very abusive, very unsettled about myself. And some people thought it was more so postpartum blues. But as time went on, I knew that it was more than that. And by the time I had my second child, then I realized that I needed some help. Some of the feelings of anxiety would be a lot of shaking, feeling like you're out of it a lot. You can even wake up in the middle of the night with a panic attack if you're having a bad dream, or sometimes your breathing gets shallow. You get heart palpitations, but you get them really, really bad, and you feel like you're having a heart attack, but you're not. You're having an anxiety attack. I went to the hospital for that probably about 25 times in my life, to the point where they're like, it's an anxiety attack, it's an anxiety attack. I was very afraid at the beginning. I didn't know what was going on. I didn't know, I felt like I was losing it. I was spending money and doing everything I could do with money and anything else, drinking, smoking. Basically, I would say in the beginning, it's really scary because you don't know what's happening to you. You know who you want to be, but you're not who you want to be at the same time. I got to the point where I knew I couldn't handle it. And I was crying all the time and just a mess. I took my kids to a center for children. I walked them in there and I said, well, I can't handle this. I can't handle the kids anymore. So I have to give them up for a while until I go get myself together. When I was diagnosed with clinical depression, which was not the right diagnosis, they gave me Valium. And in the process of taking the Valium, it really didn't do much. I kind of went up and down, up and down. Then I started getting dependent on it just because it was there for me to take. But it never really, it didn't do anything for me. Valium covered the pain, kept me doped up, and that was it. I went into the treatment center. They got me off of the Valium. They tried different types of medications, which actually made it worse because they was trying to remove the Valium out of my system, so I had to go through a lot. Once you start finding out who you are and going to the doctors and trying to get help, you're still afraid. You're still afraid because you don't know if they can help you. I mean, it's like, you know you can't help yourself, so how is medicine going to help me? You know, I got off medicines a lot of times when the doctor told me, take this, take that, take this. And when I felt like I was feeling better, I stopped taking it. And then I was back on it and ended up in the hospital again. I knew that without the medication, I would not be able to make it. Once the right medications was found, then compared to taking the Valium, it was definitely a release. Once the right medications was found, I knew that I could take care of my children, I could get my life back to normal and work through that. Really, when I think back, it was when I was young. I can remember watching my mother scrub the floors in the middle of the night, washing walls in the middle of the night, disappearing, going to the hospital. We'd ask, where's she at? Oh, she's in the hospital, and this was a constant thing. They would tell us, well, she had a nervous breakdown. So my family, they understand what's going on. We lost my brother in suicide, and then I lost my son in suicide. So that was a wake-up call for everybody. We know it's in the family, so we cannot deny it's there.
Denise Holcomb is somebody who had bipolar disorder and was misdiagnosed. It wasn't picked up. And then she had very severe generalized anxiety disorder, very severe panic attacks, and that complicated her treatment. Generalized anxiety disorder is not that difficult to diagnose. The key symptoms are simply folks who have difficulty controlling how much they worry about things. And then people who get excessively anxious about upcoming events. These are the two important symptoms of generalized anxiety disorder. When it comes to panic disorder, that's a little different. In panic disorder, people have the intense onset of fear. Comes on abruptly, comes out of nowhere, lasts 5 or 10, 15 minutes, and it goes away. And then, in addition, they have lots of physical symptoms, like palpitations, difficulty sleeping, feeling upset stomach, having difficulty swallowing, all symptoms of panic disorder. What happened is that she received Valium for treatment of these things. And what she really needed to receive was a mood stabilizer. For somebody who has co-occurring anxiety and they're treated with Valium, well, you can get dependent on that. However, when it comes to the foundation for treatment of bipolar disorder, lithium, the atypical antipsychotic agents, and anticonvulsants, you cannot get biologically dependent on these medicines. They are not addicting. You can see that Denise, but she's doing pretty well, and she's being treated with mood stabilizers. Now, when it comes to her son and her brother, they no doubt had an illness. Bipolar disorder is very genetic. The heritability of bipolar disorder is actually 80%. It's likely that Denise's relatives, at least her son and her brother, had undiagnosed, untreated bipolar disorder.
Growing up, I played a bunch of sports, played ice hockey, baseball, football, and I was injured in high school and had to figure out a way to stay involved in sports, and I decided to become a punter. And I actually wrote down on a piece of paper in the year 1988, my goal in life is to become a professional specialist in the NFL, and I was 18 at the time, and I ended up having success. I always put a lot of pressure on myself to be the best, not just to participate, but to be the best on the planet. And when I didn't meet those expectations, depression could set in a little bit. As I moved through my career, I was drafted by the Houston Oilers. I played 6 years with the Houston Oilers. And one thing I always would do would judge my self-worth of by what other people thought of me, the accolades, the amount of money I was making, all the materialistic things. And when I wouldn't get the accolades that I want, I would become bummed out. You know, I wouldn't say clinically depressed, but I'd very, very hard on myself, and that would make me work harder. My first depression, I think, when I played 6 years with the Houston Oilers and didn't get a contract done. I was coming off an all-pro year, expecting to get this huge contract, which would make me whole. But didn't get that done. I found out they signed somebody else. I ended up going and playing 1 year in Detroit, and then I quit football. And I just wasn't feeling it. I kind of lost my spirit, lost my drive. And that was probably when I first started experiencing clinical depression. I took a year off from football and met a gal, somewhat fell in love. All of a sudden, I got the urge to play again, and I think this was a riding up of my of a hypomania. I played a year in 1996 with the Baltimore Ravens, and about halfway through the season, I started feeling the aches and pains again, and the pressure. I wasn't playing as well as I would have liked to, and I started to feel the pressure to perform. After the season, I was just totally relieved and went into a mania. I was partying a little bit, self-medicating. I was doing drugs, so wasn't taking care of myself. I wasn't getting good sleep. I was just really relieved that the season was over. Everything was going well right up until the first day of minicamp. I totally lost all confidence, fell into a depression, and didn't know what was happening to me. It was very, very frightening. I had no confidence. I couldn't think. I couldn't punt very well. I mean, it was a struggle every day to get out of bed, number one, number two, to eat, number three, to work out, number four, to go out and play. I was struggling through a couple different medications they were trying me on. I think they put me on one medication, Effexor, and it made me spin into a mania, and I think that's how they diagnosed me with bipolar. The day of our first preseason game, I had a panic attack. Couldn't catch the ball. I didn't know how I was going to perform. And at that time, I mean, I really didn't know what was happening to me. I couldn't feel my hands. I had shortness of breath. I couldn't think. But it turned out my first punt went 65 yards, and it was just a matter of letting go and allowing it to manifest. But I still didn't really know what my condition was all about. I was very confused, and that whole season was really tough. I still continued to self-medicate with cannabis and alcohol, just trying to make the pain go away. There was suicidal ideation. In fact, I thought about it every day. I wanted my brain to stop working as it was, and I just wanted to, be normal again. And when it came to the diagnosis itself, I looked at it as I was being presented with an obstacle in life, and I needed to get through it. Being somewhat of an outcast as a punter, the stigma of being labeled bipolar really didn't bother me at the time. I just kind of embraced it and ran with it. After my mania subsided, I fell into a deep depression, and really I started to experience more anxiety than usual. Hopelessness, it was a separation from reality a little bit. I just really didn't really have a desire to live. Luckily, I had some real good support from my family. There were some doctors with the Ravens that did assist me and give me some medication to get through it. But it was probably the toughest year of my life. What I started to do was really start taking care of myself. I stopped drinking, stopped smoking. I started sleeping better. I started eating more healthy. I made sure that I exercised, something I always did, but I made an emphasis to get in there and do it. And in that season, I decided that I was really going to clean up my life and start handling my life in a different manner. And I chose to really start working out hard. And unfortunately, the following year, I broke my foot during minicamp, and that was the end of my career. I had to go through somewhat of a grieving period, I think, of the fact that my life wasn't going to be the same. Making the transition from professional sports to, citizen Q, as I say, is tough. Everything is structured for you. You don't have to make a lot of decisions. All your meals are planned, and when you don't have a good schedule in effect, especially when you're dealing with bipolar disorder and/or depression, it can be chaotic. And experiencing this depression and now taking this illness really for what it's worth, and really staying focused on therapy, staying focused on exercise, staying focused on compassion towards other people. I mean, this is, I think, where it's going. I mean, I was very judgmental of other people, and especially in a manic state, you can lash out and say things, and my anger got the best of me this last bout around. And it has a lot to do with my relationship with my father. I think I had a tough time letting go of a lot of childhood issues, and all of us deal with that. I mean, bipolar can definitely manifest because of some environmental issues as well. And if you don't deal with those problems, they're just going to fester until they manifest into something bigger. One thing about bipolar disorder and depression is that a lot of times we don't notice the actions or the change in moods and change in emotions that we have, and it's good to have family support, a close friend, a boyfriend, girlfriend, or just some peers that can actually help you maybe notice the changes and help you move towards a more healthy way of approaching life. I mean, everybody's going to go through some cycling with bipolar disorder and depression, and having someone there to maybe point that out to you is something that can be very beneficial.
Now, Greg is a good example of how somebody can have bipolar disorder and be productive and successful. Greg managed his illnesses well. So just because you have bipolar disorder, that doesn't mean you're not going to be productive or successful. Look at people like Abraham Lincoln, Isaac Newton, Winston Churchill. Lots of people have bipolar disorder, and many of them have been very, very successful. Like most of the folks we've heard from today, Greg is a really good example of how you manage your illness. He talks about healthy living. He talks about exercise, about diet, all the common sense things we all know are important. Well, these things are also very important in bipolar disorder, and he's a wonderful example of this. It's important to recognize how stigmatized patients feel who have bipolar disorder. Now, you wouldn't feel that way if you had heart disease or diabetes. And we actually know now that there are neuroanatomical changes in the brain that go along with bipolar disorder. There are changes in chemistry. Bipolar disorder is every bit of a real illness as heart disease is. It's just this lack of misunderstanding. These are real illnesses that require real treatments, and people do just as well as the treatment of other illnesses like heart disease and diabetes.
I didn't really understand bipolar to its full extent until probably 2007. When I was first diagnosed, I didn't believe it. I had my parents were supportive in my disbelief of bipolar. I didn't take meds. I didn't seek counseling. I coped with it on my own. I used substances to help medicate myself, but I didn't understand the bipolar until it got really, really bad. I had a manic state before my depressed state. For my first episode, it was a lot of drug use. I cheated on my boyfriend at the time. I destroyed friendships. And then I was depressed afterwards when I realized what all I had done. I had a scooter. I was on a motor scooter and I had a motor scooter accident. And I got really depressed after that. Depressed to where I was having suicidal thoughts. And the doctor I was seeing, he didn't know how to treat me correctly. So he recommended that I go to stay in a hospital for a while and see if they could get meds regulated and see exactly what was going on. That's when I first found out that I had bipolar. But like I said before, we did not believe it. We didn't want to believe it. It seemed like a joke, like I was misdiagnosed. No, that couldn't possibly be it. And after that hospital stay, I got sober, and my parents took me to a family practitioner, and gradually he weaned me off of all the psych meds that I was on. And I was fine for a while, probably a year or so, and then I started having episodes again. A huge episode for me is when I have to go to the hospital, when I have suicidal thoughts, homicidal thoughts that I just cannot control, or when they're to a point that they scare me, where I'm worried about what would happen. My episodes were becoming close together, and I could cycle days apart or in the same day. I would be manic in the morning and then depressed at night. It was exhausting because I felt like I was losing myself. I was losing control because I couldn't control myself. I couldn't just be happy. I couldn't just be stable. I was sober for a while, and then when I started to feel myself going into another episode again, I started using again. And when I used daily. It made me feel normal. It seemed to keep me under control more, where it seemed like the psych meds weren't working, but I didn't give them a chance to work. So when I was just using and not on any meds, it would work to a certain point, and then a huge episode would take place. At one point, I went to my family practitioner and said that I was having problems with highs and lows. And that was when I was starting to get the heads up that yes, the bipolar was real, and yes, you do have it, Melissa. But that's when they prescribed the lithium. And at first I wasn't too sure of it, but it's such an old drug. It's been around for so long, and that comforted me, and I was more than willing to give it a shot. There were times where I would go off my meds because I would feel great, feel wonderful. And I'm like, you know what? My mom and dad have been praying for me, so maybe they're right. I don't have bipolar anymore. So I would go off my meds, and then an episode would happen, and it's like, okay, I guess I still have it. So I would have to tell my doctor, I'm sorry, I went off my meds again. The last episode I had was terrifying. I had homicidal thoughts, which they started off as I just wanted to hurt the people on the TV that I saw. And then when it started to be that I wanted to hurt people that I actually knew, people in my town, then that's when I knew that something was seriously wrong. Went to my doctor, and that's when he suggested ECTs because I was all over the place. I was manic, I was depressed, and I wasn't getting relief. It wasn't like I would get an episode, then I'd be fine for a while. No, it was episode after episode. It was just continuous. And we did the ECTs. The ECTs were wonderful. Trusting your doctor, because he knows what's best for me. I know that. It was a lifesaver. It got my life back. I became the mom that I wanted to be again. I would recommend it to anybody. The thing that helped me most with my bipolar was not being afraid to try new things, try new medicines. I have a wonderful support system at home. My boyfriend, he's very aware of my episodes, and sometimes he will tell me, hey, you need to check yourself. I think you're cycling. And I stop, and I'm like, okay, yeah, because he's usually right. He's so supportive, encouraging when I feel like the smallest person. He helps and builds me up. I am very open with my daughter. She's my little trooper. She's great support for me. She knows that, sometimes mama gets sick. And usually when I have episodes, she goes and stays with my parents. But she's not far. My parents are my neighbors, so she's never far from me, and I always see her every day. I have a very happy life now. It's right where it needs to be, and it's such a relief after all the trials before, but it's worth it because I'm so happy now. If you want to get well, you'll fight for it.
Melissa had a long history of treatment non-response. She got lots of different treatments and it didn't work. And what we can learn from her case is that electroconvulsive therapy, ECT, is a modality that works for treatment of very severe depression. ECT is an abbreviation for electroconvulsive therapy. And what we've learned is that when you induce a seizure, the seizure has antidepressant efficacy. So if somebody has ECT, they go to the hospital, they have an anesthesiologist that administers anesthesia, they go to sleep, and then during the sleep, they have a seizure electrically induced. Now, you would have treatment like this on Monday, Wednesday, and Friday for several weeks, and usually after 6 to 12 treatments, the depression goes away. And the response rates for ECT is actually the very highest response rates. So if somebody has a really severe depression, this is a reasonable consideration for folks who have stubborn, hard-to-treat bipolar disorder. Today we've talked a lot about substance use disorders, about them co-occurring in bipolar disorder. Now there's two types of substance use disorders. There's one type in which people will abuse a substance, and then there's another type in which dependence develops. So abuse is simply any use that leads to impairment in work life or family life or social life. Dependence is a different story. Dependence is something that results when somebody's used over a lengthy period of time. And what happens is that people develop tolerance to the substance. So they'll have less effect from the same amount of use, or they need to use more to have the same effect. And of course, if dependence is really severe, you can have withdrawal symptoms. But the take-home message here is simply recognize the co-occurrence of either abuse or dependence in bipolar disorder and make sure it's diagnosed and treated. Melissa's case is actually quite remarkable. Now here's a woman who had a really tough 10, 15, 20 years. But when you saw her today, she has a very good insight. She's very healthy. She's managing her illness quite well. So, people with serious mental illness can actually do quite well, and she's a good example of this.
I lost my husband, John, to suicide 7.5 years ago. He was a very normal, average, above average individual. Success in business. He was very well educated, had a family, very happy, and anyone to look at him would think that he had it all. But he also had a mental disorder, and that was not apparent because he was able to mask his illness with the positive things in his life. People who suffer with depression really are able to do that. And it's when these things that they put in front of themselves as masks are taken away that the demons of depression, if you will, come out. And for John, he had lost his job. And he had lost his job at a very critical time. It was a very devastating situation and led to about a 3-year spiral. His job was his persona and career. And having taken that away, he was much more susceptible to giving in to the depression. We become very, very agitated, obsessive about things, and then become very withdrawn. And those periods became longer. I knew that he was suffering with depression. It seemed obvious. I got to a point where I simply said, I'm not a professional. I can't help. You have to get professional aid and assistance, and I made it an ultimatum. He was very resistant to getting any help because he had a great deal of pride, and I do believe that there's a great deal of shame attached for an individual to admit or say that they have depression. He went somewhat kicking and screaming, if you will, into treatment, and I thought that that was the best course. He was getting treatment. There was talk therapy and medication. And however, his behavior was not improving. And in fact, I didn't think he was getting well at all and having even a more difficult time. Prior to the major onset of these symptoms of his illness, he was just an average social drinker, and no problems per se. And however, once he was really suffering with depression, he was self-medicating with alcohol. And and also a combination of whatever medications he was on. It's just bad. He would have episodes of, which I now understand as mania and manic and depression, where he would be extremely agitated. So, not to speak from a clinical standpoint, but the mania isn't always euphoria. It's a very agitated state. So he'd become very, very agitated, obsessive about things, and then become very withdrawn, which would be, of course, the more depressed state. But what I found is that these episodes became worse, really exacerbated. And he would have times of absolute rage. And I don't know how to describe it other than it wasn't him. And I could just see these, I always call it the demons of depression, just take over. The challenging thing for me was that I really wanted to be involved in that treatment, because what happens in the therapist's office is not necessarily reflective of what happens in the person's home or in their life. And it clearly wasn't the case with John. I saw behavior that was just not, going downward. And I tried to become involved in the treatment and contact his counselor, and the counselor would talk with me on the phone, not talk with me, listen to me on the phone, while I said, here's what's happening, please tell me what is going on. And he wouldn't share with me anything that happened during the counseling because of HIPAA regulations. And I understand those regulations. However, I really believe, especially when you're dealing with issues of the mind, it's so important to have the input of the family, of loved ones who live with the person, who are living that illness. And I really believe that it should be part of the intake process with the medical professional to include the family or the loved ones. So these kinds of things became worse as he was going further into treatment. And that's when I would try very hard to become involved in the treatment. And I was not able to.
Lori's story tells us about the importance of family. If she would have been involved early, it's much more likely that he would have been diagnosed right away. Family involvement at the time of the initial assessment is important for two reasons. One, people benefit from having the supportive family present at the initial assessment. Two, sometimes people don't know they have the symptoms of mood swings, and the family can help with this. It's very difficult to get a history about the highs. This is when you really need the family involved, especially for somebody who's been productive and employed and achievement-oriented. One of the unique things about psychiatric illness is that it's unusual for psychiatric illness to present by itself with just one illness. This is particularly important in bipolar disorder because the vast majority, literally 99% of people who have bipolar disorder will have another co-occurring illness. The most common co-occurring illness is alcohol abuse. So in Lori's instance, that's exactly what happened. What we can learn from that case is that we have to ask about alcohol abuse, and we have to ask about drug abuse. And then the third most common co-occurring illness is generalized anxiety disorder, feeling anxious most of the time. When people are thinking about suicide, it's usually because they're feeling down, they're feeling depressed, they're feeling hopeless. However, it's the presence of a problem with alcohol or drugs or anxiety that makes someone who's just thinking about depression make plans to attempt suicide. It's the anxiety and it's these other illnesses that convert someone who is thinking about depression, thinking about suicide, to planning and attempting suicide. So this is why these other co-occurring illnesses are really important. So today we've heard people who are very committed to the recovery and very committed to managing their illness. And managing bipolar disorder is much like managing heart disease. People who manage their illness well get better. And it's very important in bipolar disorder to manage your illness, attend regular follow-up meetings, and most people who do get better. When you treat illness that hasn't been around so long, it's pretty easy to treat. But if you let this illness go for a while, it's going to get a mind of its own. So if you got these symptoms, get treatment. If you want to go to websites that have a special interest in helping people learn about bipolar disorder, go to the American Foundation for Suicide Prevention, and they'll give you a good list of places that you can go to.
If you identified with what you've heard today, please check out the information at the end of this film. There are resources available to help you or someone you love how to manage bipolar dis-ease. And thanks for watching.